Hello learners, welcome to Counseling 5220, Introduction to Marriage and Family Therapy. I will be your instructor for this course. My name is Dr. Paul Mayoni and I have been teaching with Capella since 2003. And I teach a variety of core courses in the Marriage and Family Therapy program. You should know that whether you know it or not, marriage and family therapists are the rebels of the mental health field. Many of the early pioneers of family therapy were kicked out of psychiatry and psychology and the AMA. They came to family therapy from other fields, and at the time it was a radical shift to have multiple people in a counseling session. And many traditional therapists at the time felt that that was heresy and it was an invasion into the therapeutic process. What they didn't understand is that the family therapists were on the verge of a revolution in mental health, in that they began to think about traditional psychological and psychiatric symptoms in a more relational or systemic context. So we're moving away from what we're all steeped in, which is the cultural idea that there is individual pathology, and those pathologies are within people, individual people. And what the pioneers of family therapy were saying was we could look at those same symptoms in a more interactional context, and we could make sense of them if we looked at a system of people, most notably families. We could make sense of those same symptoms if we looked at the dynamics and the relations that went on between people rather than within the individual. So this was a radical new way of thinking about problems, and in many respects, it's still a very radical way of approaching problems. And most practitioners of mental health have not been trained in anything other than individual pathology. So as family therapists, we have a lot to offer the variety of contexts that we can choose to work in, because we do view the world so differently. And we do approach things like assessment and intervention from a very different perspective. You're going to learn a lot of exciting ideas in this course, and some of them have to do with the distinction between a linear and systemic epistemology. Much more to say about that. We're going to talk about social constructionism and constructivism, and the importance, most notably, of the idea of context and how that's relevant to the work we do as MFTs. This course will stretch you, and so I would encourage you to have patience with yourself. The journey to thinking systemically starts here, but it will go on throughout your entire program. And you do have to be patient with yourself, because this is a new way for most of us to think about the world and our place in the world and the relationships we have with other people. So it's a really nice introduction to a different way of understanding, again, not only the work that we do as MFTs, but it can't help but spill over into our own lives as well. A couple of reminders. A good place to start here is to go to the discussion board and read the faculty expectations for this class. Among other things, you'll find out the importance of using citations in your postings and APA format. Post a response to this welcome video. Let me know that you were able to view it and you were able to hear it, just with one response saying that you were able to view it, maybe something that it sparked in you. I'll be doing similar kinds of videos throughout the course of the semester to summarize various units. So this will be the first in a series of a few that you'll see over the course of the next 10 weeks. I'm very excited about teaching this class and getting to know each of you. And again, first tasks after viewing this would be to post a response. And if you haven't done so already, read the faculty expectations and post a response there as well. Okay, talk to you soon.